Bismillahirrahmanirrahim. Assalamu alaikum. Hi guys. Welcome to my YouTube channel Psych. My name is Muhammad Yaseen and I'm a psychologist by profession. I have started the psychotic disorder series. Last time I was talking about bipolar disorder. If you didn't watch that video, I'll share link in my description. You can watch that video. Today I'm going to talk about another psychotic disorder, that is schizophrenia. First of all, let me tell you that schizophrenia, it's come from the Greek word which means mind splitting. Schizophrenia is a serious mental illness that affects how a person think, feel and behave. It's a psychotic problem where a person lost their contact with reality. In psychology, there are two levels of psychological problems. One is psychosis, one is neurosis. I have already made video on this topic. You can watch that video. So in schizophrenia, disorientation occurs in time, person, place. A person don't know that where I am, whom I am talking and what time is going on. When we do talk about the prevalence rate of schizophrenia, so schizophrenia affects 20 million population worldwide. Several studies indicate that schizophrenia is higher in men as compared to female. Now let me discuss the symptoms of schizophrenia. There are two kinds of symptoms. One is positive symptom and one is negative symptom. First of all, let me talk about the positive symptoms of schizophrenia. During problem, a person get some symptoms in their personality, such as hallucination, delusion, and disorganized speech. Let me touch the word hallucination. That what does it mean? Hallucination, it's a wrong perception where a person experiences something without the existence of any stimuli, such as auditory hallucination, visual hallucination, common hallucinations. The most common type of hallucination in schizophrenia, that is auditory hallucination. Auditory hallucinations mean that where a person experiences some kind of voices without the existence of any stimuli. That's a auditory hallucinations. Visual hallucinations mean that where a person sees something without the existence of any stimuli. That's a visual hallucination. The next symptoms are positive symptoms in schizophrenia, that is delusion. Delusion, it's a false belief. Sometimes because of overthinking, a person makes false belief on their self. And there are several delusions, such as delusion of persecutory, delusion of grandiosity, delusion of preference. The most common type of delusion in paranoid schizophrenia, that is delusion of persecutory. Delusion of persecutory means that sometimes a person who makes this belief that other people, they are trying to harm me, they are trying to kill me. For instance, there are two people, they are talking about something else. Let's take the example, they are talking about the cricket. But a person who have a schizophrenia, a person who have a delusion of persecutory, so they do think like that they are trying to talk about me, they are trying to harm me. So that is delusion of persecutory. There is one another delusion, that is delusion of grandiosity, where a person make belief on their self that I am most powerful person, I am a very superior person, I can do each and everything, I have a lot of knowledge, I have a lot of powers. So that is known as delusion of grandiosity, which is very far away from reality. In reality, it's not like that. The next positive symptom of schizophrenia, that is disorganized speech and behavior. Because of thinking too much, because of different problem, a person's speech and behavior become disturbed. People do not understand that what they are trying to say. People do not understand that what kind of behavior they are showing. So that is disorganized speech and behavior. So that was the symptoms of positive symptoms of schizophrenia. Now let me talk about the negative symptoms. In negative symptoms, a person lost something from their personality. For instance, each and every person has interests, Each and every person has motivation. So in negative symptoms of schizophrenia, a person lost their interest, a person lost their motivation, a person lost their pleasure, a person get problem in their sleep, trouble sleeping, a person become irritable. So these are the negative symptoms of schizophrenia. When we do talk about the causes of schizophrenia, there are two main causes. One is biological cause and the second one is environmental cause. First of all, let me talk about biological cause. In biological cause, first things we have that is genetics. Sometimes schizophrenia run in family. The second cause in biological, that is imbalancing occur in our neurotransmitter such as dopamine. When the level of dopamine become high, so a person gets schizophrenia in their personality. And another cause, that is delivery complication. So these three causes come in biological cause. The next cause we have that is environmental cause. Environmental cause, the first thing that's come that is poor relationships. Problems in relationships lead schizophrenia in someone's personality. The second one is environmental stresses. There are several environmental stresses available and sometimes those stresses lead schizophrenia in someone's personality. And the last one is alcohol and other substance abuse. Sometimes because of alcohol and other substance abuse lead symptoms of schizophrenia or psychotic features in someone's personality. So these are the environmental cause. If someone who experience or in your family anyone who experience such kind of symptoms for 6 months, so that person should visit to a doctor. Because in schizophrenia, medication is very important. Psychiatrists prescribe antipsychotic medication and sometimes psychiatrists prescribe shock therapy as well. I hope that you got something from this video. If you like this video, so do like it, do subscribe my YouTube channel and share it with your friends. Thank you so much. See you in next video. Allah Hafiz.